And again, along the same lines, so I just wondered if you could talk a little bit about how infusion clinics are cleaning and preventing or creating precautions to keep patients with IBD safe, as well as their staff.
Yeah, very good question. So it starts with what Noreen mentioned about screening, but then when you think about the clinics have always had IPAC standard or infection prevention and control standards in place. As healthcare professionals, we've always done that. Over the last several months, we've had task force working on what to do in the case of this pandemic, and so we've increased cleaning practices. There's certainly increased surface cleaning. We use Virox wipes, which are wipes that we use on the surfaces and on the chairs and between patients. There's absolutely increased hand washing. Several weeks ago, we started asking every patient to wash their hands when they arrived at the clinic, which was something that hadn't been done before. There's obviously sanitizer at the clinics. We're lucky to still have it available, but actually asking patients to wash their hands with warm soapy water for more than 20 seconds and showing patients how to do this properly. And I think there's some amazing videos out there on hand washing, and I would recommend everybody watch those videos, because even, you know, lots of people think they wash their hands well, may not. So washing for at least 20 seconds is really, really important. We're also trying to do social distancing inside the clinics, meaning we're trying to move patients away from each other, trying to spread out the infusions over the day so less people are there at the same time. Physically spacing them apart, putting a physical barrier in between them. We have some vinyl screens that we can put between chairs, and we wipe those down again with the Virox wipes. I think everybody is really, really hypersensitive to the need to clean everything, clean their hands. Patients are in some cases being provided with a mask as well to wear inside the clinic in case they can't be far apart enough from the next patient, and the nurses are wearing what we call PPE, or personal protective equipment, to make sure that they're also protected in this case and at all times, and washing hands lots and lots.
And I'm just wondering if any of the other panelists wants to add anything else in terms of cleanings, precautions, preventions.
I would just make one comment, and I think everybody's aware of this, is there's a global shortage of personal protective equipment. And so as infusion clinics, we've all been looking at our policies and how we're implementing that PPE and when we're implementing that PPE from a risk perspective. And as the risk in certain areas of community outbreak increases, it's been increasing. So we're all moving to all of the clinics eventually will get there. I would say probably right now, not every clinic everywhere needs it from a risk perspective. But, you know, if we had this conversation next week, probably would be, but we're trying to make that life last longer for our personal protective equipment, as there is a global shortage, and we're all working hard to make sure we have enough of it when we need it.
It's a good point, Noreen, and I think, you know, we always have to look for good things when we're in this kind of difficult situation, and we've seen all kinds of companies stepping up. So Labatt stepping up and making hand sanitizer. There's a company called Bauer who makes hockey equipment in Canada that are making face shields, and those should be ready soon. So while we do have a shortage and we're working really diligently to get through that, we're also seeing some great things with companies that would normally manufacture one thing, and they've been changing their production line to help healthcare companies out.